Myself Bhumika M. Barki, student of SSAMC Haveri, studying in final year. Presentation on Indralupta from the Department of Panchakarma. Contents: Introduction, Anatomy of Hair, Introduction and Kesha Utpatti according to Ayurveda, Common hair conditions, Causes of hair fall, Indralupta, Nidana, Rupa and Chikitsa, Common protocol and prognosis, Indralupta versus Kalitya, Alopecia and its management. Conclusion. Alopecia areata is an autoimmune disease characterized by hair loss on the body, especially on the scalp, without any clinical inflammatory signs. Its prevalence in the general population was estimated at 0.1 to 0.2% with a lifetime risk of 1.7%. Male was reported to be more affected with the disease in comparison to children and women, but it can cause more emotional problems in children and women due to cosmetic concern. So, world is accepting some remedies from alternative medical sciences. Ayurveda offers different effective treatment modalities for the management of different autoimmune diseases like psoriasis, eczema, etc. Clinical presentation of hair loss can vary from loss in well-defined patches to the diffuse of total hair loss termed as alopecia totalis or alopecia universalis, which can affect all hair-bearing sites. Graying of hair is one of the major complications because of the destruction of melanocyte-associated proteins. Alopecia areata can be correlated with Indralupta disease described in Ayurveda. Indralupta is considered as a non-scaring, non-inflammatory alopecia, whereas Kalitya is termed as non-scaring inflammatory alopecia. Anatomy of hair. Introduction. Hair is a cutaneous appendage typical of mammalian skin. It is keratinized product of hair follicle. Although it originally evolved as a protective coat, it has lost this function value in humans except probably over the scalp. Thus, man is one of the least hairy mammals with the most body hair being fine and delicate. Each head holds an average of 85 to 140,000 individual hairs. Normally loses 100 to 150 single hairs each day, approximately grows 15 cm every year. Growth rate average about 0.4 mm on the scalp. Each hair can grow for up to 7 years before falling. Each follicle consists of muscle and the sweat gland. Areator pili, the muscle that lifts your hair on end when you are cold and scared. Apocrine gland produces the second hormones called as pheromones. Dermis, follicle sites in the dermal layer directly beneath the epidermis, packed with the nerve endings and the blood vessels. Fourth, epidermis, outer layer of the skin made up of 5 dead layers of keratin packed cells. Hair follicle, the organ of hair growth. Layers of hair follicle are internal radicular sheet, external radicular sheet, dermic radicular sheet. Bulb, bottom of the hair follicle consists of papilla and blood vessels. Papilla are actively dividing the cells that produce the hairs. Blood vessels feed the growing hair. This is a cross section of the hair shaft showing all the 3 layers, namely cuticle, cortex and medulla, and the image of hair follicle. Structure of hair. Hair is an appendage of the skin that grows out of an organ known as hair follicle. Hair is made up of 3 general parts, namely follicle, root and shaft. Follicle, tube-like organ in the underlayer of the dermis and is lined by the body's blood supply. Root portion of the hair below the skin embedded in the follicle. There are 3 basic scale structures named as corona, spinous and imbricate. Stages of hair growth. Hair follicle, the structure that produces the hair, go through a cyclical process with the 3 main stages. Growth phase called as anagon phase, transitional phase as a catagen, resting phase as a telogen. After the resting period, the hair follicle enters the shedding phase, that is exogon, where the hair follicle is shed and the cycle begins anew. Types of hairs. Prenatal hair. Lanigo hairs are those that cover the fetal skin. They are shed at the fetal age of 8 to 9 months or after birth. Postnatal hairs. According to the thickness of the shaft, hair are classified into vellus hair, terminal hair and intermittent hairs. Functions of hair. Protection. Protects the scalp from injury and sunlight. Eyebrows and eyelashes protect the eye. Hair in the ears and nostrils keep out the foreign objects, helps regulate the body temperature, touch receptors associated with hair follicles. According to Ayurveda, Introduction to Kesha, Etymology and Derivation. Kesha, the word is derived from the root word Ke means mastaka with Shi to Shite, sleep. Definition: the one that is sheltered over the head. Kashyate, Prakashate iti Kesha, the one which shines. Synonyms: the synonyms of Kesha are Chikura, Kuntala, Kacha, Shiroruha, Murdaja, Jatadhara, etc. Panchamahabhautikatva: Kesha, Loma, Roma, Mukha, Smarshu are Parthiva Dravyas. Kesha has Mala. Mahabhuta Sharira Guna is Abhadakara and which is accumulated in Sharira Chidra, that is Sukshma and Stula, should be expelled. Kesha as Loma or Mala of Asti. Kesha is Sharira Avayava. Kesha, Smashru, Loma and Naka are Avayava and are nourished by Kitta Bhaga of Ahara. Kesha has Upadhatu. Kesha is one of the Upadhatu and it does Dharana and not Poshana. Snigdha, Slakshna, Mrudu, Prasanna, Sukshma, Alpagambira, Sukumara Loma is Tvaksara Lakshanas. Shira Kapala. Keshantara and Mastakantara should be 11 Angula Pramana. According to Dalhana, Mastakantara and Keshantara should be Dashangula. Vascular relations of Kesha, Sira, 4 Avedya Shiras related to Keshantara, 1 related to Avarta Bhaga and 10 are related to Shankadesha. Dhamani, Ashtatriyak Dhamani are described. Kesha Utpatti. Kesha is considered as Parthiva Dravya. It is derived from the Prithvi Mahabhuta and is one among the Pitruja Bhava which is obtained from father. Child having the black, soft, long hairs are among the ideal features mentioned in the context of Putreshti Yajna. Kesha is considered to be formed in the 3rd month of pregnancy. Kesha is Kitta Bhaga of Ahara and as a Upadhatu of Asti. During the description of the Dirghayu Lakshana, it is mentioned that the person having the discrete, soft, oily, deep-rooted and black hairs will enjoy a long life. Physical attributes of the hair vary according to the Sara Lakshana of person. The person with Vata Prakriti will have small hairs, whereas person of Pitta Prakriti will have soft grey hair followed by early hair fall. The person having the constitutional essence of Medha Dhatu will have soft and oily hairs on his body. Acharya Charaka enumerates Kesha are about 29,956 present in the body, while explaining the Shrotas inside the body are connected to the root of the hairs. The Kesha and Naka don't have Adhisthana of Atma and Indriya, especially the Sparshanendriya. Dosha affects the Dhatu till the activity of Sparshanendriya present. Absence of knowledge of any sense, Roma Kesha indicated that there is an absence of Atma, Manas and Indriya. Disease like Kalitya, Palitya, etc. is the result of dosha afflicting the dhatu present in Sparshanendriya Adhisthana, which affects the Kesha and Naka. The place where Kesha grows is called as Kesha Bhumi, and any abnormality in Kesha Bhumi will reflect in the health of Kesha. Common hair conditions. According to Ayurveda, Kalitya, Indralupta, Palitya, Hariloma, Dharunaka, etc. are explained. Causes of hair fall: Astikshaya, Kesha Sadhana, Ashtangarudaya Sutrasthana, 11th to 18th Shloka, Svedakshaya, Roma Chutti, Darunaka, Kesha Chutti, Krumi Prabhava, Lavanakshara Prayoga, Kalitya, Dushta Pratishaya, Upekshita, that is Kalitya. Indralupta, Nidana, Pitta accumulation in hair follicles, Tejo Aniladya Tridosha, Vata Pitta in association with Kapha Shonita along with Pitruja Bhava Vikruti, Asti Majja Dhatu Agni Vikara, imbalance in Dhatvagni of bone marrow tissues, Kshara Ati Upayoga, Medo Shonitodbhava Krumi like Kesada, Lomda and Loma Dvipa, Rakta और Vasaki मल से उत्पन्न होने वाली रोगाणु, that is microbes arising due to blood and fat tissue vitiation. References Charaka Samhita 7th chapter. Rupa of Indralupta. Romakoopanugam pittam vatena saha muchitam प्रचावयति रोमाणि ततः श्लेष्म शोणितः रोमकूपान् रुणध्यस्य तेनायेषाम् असम्भवः तत् इन्द्रलुप्तं रुढ्यां च प्राहुश्चेति च अपरे. Pitta located in hair follicles when get aggravated along with the Vata causes fall of hairs. Thereafter, vitiated Kapha along with Rakta block these hair follicles resulting in non-growth of new and the condition is called as Indralupta. Chikitsa for Indralupta. Siraveda. Snehana and Svedana is followed by Siraveda. Panchakarma called as deep scraping. It is performed at the site where Indralupta is located and it is followed by various lepas. Different types of lepas are prepared like Kasisa, Manuvaha, Tutta, Ushna or Maricha. Cinnamon or Devadaru paste is prepared. Madhu, Grita, sesamum flowers and Trikantaka or Gokshura paste is prepared. Roma Rasanjana Lepa is an extremely good medicine for the growth of new hairs. Indralupta Nashaka Taila or Jhatyadi Taila is beneficial in curing the Indralupta. Sechana of the water on the head or head bath should be avoided till the growth of new hairs. Rasayana should be given orally like Amalaki Rasayana mixed with Trifala Churna. Shirolepa with Tikshna Dravyas like Datura Patra, Gunja Mula Phala, Tagara, Kasisa, Manashila is done. By using the Jivaniya Siddha Taila or Nimba Taila, Nasya is performed. Shiro Abhyanga is done by using the Prapondarikadi Taila or Malathyadi Taila. Wet or dry cupping therapy is performed for Indralupta. Common protocol for Indralupta. For external formulations like Gandhaka Rasayana, Manjishtadik Vata, Kaishora Gugulu, Amalaki Churna, Saptambrita Loha, Shatavari Rasayana, Chavanaprasa Rasayana, Arogya Vardhini Rasa are administrated. For local application like Gunjadi Lepa, Manashiladi Lepa, Malathyadi Lepa for Shiro Abhyanga, Bringaraja Taila for Shiro Pichu, Anu Taila and Estimadu Taila for Nasya are administrated. Prognosis of Indralupta depend upon Kesha Bhumi or scalp structure. Incurable if all features of Tridoshas involved Nakaprabha, Nirloma, Sadaha, Dagda Agni Nibha, that is scarring alopecia. Indralupta versus Kalitya. Nidana, Vata Pitta Prakopa for both. Acharya Vagbhata differentiated Indralupta and Kalitya by saying Kalitya is loss of hair gradually, then that Indralupta, but pathology being common in both. Indralupta is non-scarring non-inflammatory alopecia, whereas Kalitya is non-scarring inflammatory alopecia. Definition of alopecia according to modern. Alopecia is a condition affecting the humans in which hair is lost from some or all areas of the body. It only affects the 1% of the population. Although it is not a life-threatening, it can be a psychologically traumatic. Causes: genetic, immune system dysfunction, stress, infections or illness. Signs and symptoms: patchy hair loss, sudden hair shedding, regrowth with white or fine hair, nail changes, widespread hair loss. Diagnosis: physical examination, pull test, scalp biopsy and blood test. Common hair conditions like non-scarring alopecia include tinea capitis, hormonal changes like hypothyroidism and androgenic alopecia, anegan effluvium, trichotillomania, secondary syphilis, deficiency of iron and zinc. Scarring alopecia includes scleroderma, tinea capitalis, inflammatory type, folliculitis decalvensis, etc. Management and treatment for alopecia are corticosteroids, photochemotherapy or light therapy, platelet-rich plasma, 5-alpha reductase inhibitors, minoxidil, ketoconazole, JAK inhibitors, athrelin, contact immunotherapy, natural and home remedies, hair transplant or wigs. Conclusion: Indralupta mentioned in Kshudra Roga due to Alpahetu Lakshana Chikitsa. Proper analysis of condition based on Hetu Sevana and Lakshana and selection of the treatment accordingly leads to successful treatment. Patya Sevana is must. Thank you.